Welcome. This explainer is based on the article Role of Music Therapy in Neurocritical Care for Patients with Acute Brain Injury with Disorders of Consciousness, which was published in the 2025 edition of the journal Neurocritical Care. You'll find links to the bibliography in the description below. So let's start with a couple of key questions to think about. For a patient who's unresponsive after a severe brain injury, could their favorite 80s rock anthem be more than just background noise? I mean, could it actually be a diagnostic tool and a therapeutic lifeline? And building on that, how do we detect what's called covert consciousness? That is, a mind that's aware but essentially trapped. We're going to explore how personalized music might just help reveal the person inside the patient. Okay, so our clinical symphony starts on a silent stage. This is where we face the profound challenge of disorders of consciousness, or DOC, where the clinical picture can be so incredibly unclear. Let's meet Barbara. She's 47, and after severe brain hemorrhage, her Glasgow Coma Scale score was a 3. That indicates deep unconsciousness. You can just imagine the immense questions facing her family and the entire clinical team. Now, before we go any further, we have to make a really critical distinction here. We're talking about music therapy. This is a clinical, evidence-based practice delivered by a board-certified music therapist. It is absolutely distinct from what's called music medicine, which might just be a non-certified professional playing a recorded song. This is a targeted clinical intervention. With that clinical stage set, the first, very delicate notes of therapy can begin. This part is slow, it's intentional, and it's all about establishing a connection and finding some physiological stability. So, within just 72 hours of her admission, the music therapist meets with Brian, Barbara's husband. And this isn't just about getting a list of favorite artists. No, he shares stories of their life together, their shared love for 80s rock. He shows photos. He helps the team see Barbara, the vibrant person beyond the patient in the bed. And this is where you really see the precision of the protocol. This is not just playing music, it's a very controlled sensory intervention. The therapist acts like a clinical conductor, synchronizing the tempo of even a single guitar note to Barbara's own respiration rate, all while keeping a close eye on her vitals. Then, the therapist starts to hum a simple, familiar melody. Brian recognizes it instantly. It's their song, Faithfully, by Journey. He takes Barbara's hand. And while Barbara herself shows no outward signs of waking up, her vital signs remain completely stable. That's a small but really significant sign of non-agitation in a patient this fragile. And now the narrative starts to build. We're shifting from that quiet, passive listening to the very first signs of an awakening. This is the crescendo, and it's all guided by a structured clinical framework. And then a breakthrough. It's her 4th session. Brian and the therapist are singing an REO Speedwagon song, and Barbara opens her eyes. Not once, but 3 times. Brian holds her gaze. This is it. The person inside the patient is starting to emerge. Progress like this doesn't just happen randomly. It's guided by something called the tempo framework. You can see the elements here: timing, engagement, music selection, psychosocial support, and ongoing monitoring. You can think of this as the actual sheet music for this whole complex clinical intervention. And here's the objective data that really tells the story. You can see a steady rise in Barbara's Glasgow Coma Scale score, going all the way from a 3 to a 10. And these improvements are noted in direct temporal association with her music therapy sessions. So for the final movement, the whole symphony transforms. Barbara shifts from being a passive recipient of care to becoming an active participant in her own recovery. She's helping co-compose her own rehabilitation. This visual really shows the entire therapeutic journey beautifully. You see, music therapy evolves right alongside the patient. It kicks off in phase 1, focusing on stabilizing vitals and supporting the family. Then it moves to phase 2, working to promote arousal and co-treating with PT and OT. And it all culminates in phase 3, which is all about active engagement and meaning-making for the patient. Fast forward a few weeks. Barbara returns for a planned surgery, and she is a different person. She's talking, she recognizes the therapist from videos, she's requesting songs, and she's actively using music in her physical therapy, singing along to her favorite tunes to help regain motor function. Her husband Brian really summarizes the impact on their family so powerfully here. He points out that music wasn't just a comfort. It became a source of hope and a practical, powerful tool they could use for her ongoing rehab, even at home. Okay, so what does all this mean for your practice? What are the key things you can take to the bedside tomorrow? Here are 3 really practical points. First, differentiate and advocate. Know that this is a clinical discipline, and you should refer to a board-certified therapist. Second, get the family involved, and do it immediately. They're your absolute best source for the personalized stimuli that can unlock these responses. And third, use the TEMPO framework. It will help you structure these interventions for maximum safety and efficacy. So to wrap it all up, this approach really addresses the complex needs of both the patient and their family at the same time. It's a powerful, non-invasive tool that supports neurological recovery, it helps stabilize physiology, and it enhances truly family-centered care. And if there's one simple phrase to remember and share with your colleagues, make it this one. It's your whole framework for applying music therapy in the neuro ICU. Tune into tempo. So we want to encourage you to apply this knowledge. The next time you have a patient with a disorder of consciousness, don't just see the patient in the bed. Ask about the person and the playlist that shaped their life. Consult the family about their loved one's musical identity, and consider a referral for music therapy. Thank you for joining us for this explainer. You can find the disclaimer and bibliography in the description.